Hi, I'm Oliver Khoo. I've been an orthopaedic surgeon with St Vincent's since 2011. If you're considering a hip replacement, it can feel overwhelming and there is a lot to understand before you make a decision. So, to help you get started on your journey, here are the answers to the most common questions that patients ask me. Hip replacements can last for decades. So this is a hip replacement. This side's the femur with the ceramic pink head, and on the cup side there is also a matching pink head, and it's really friction free and smooth, and the expectation would be that the ceramic doesn't wear out. It lasts for an extremely long time. There's other reasons why the implant would fail. People can fall and have fractures around the implant. That might be the reason why it needs to be revised. Dislocation can occur, so the spine and the way the spine moves influences the position that the implants are in, and the implant can be in a good position and then someone develops back problems and it can mean that the implant becomes unstable. To overcome some of those things, there's different planning that we do, so technology-assisted surgery, where we actually assess the actual hip and the spine and the combination of movements that happen in those two areas, which mean we can place the hip replacement in an ideal position, but still the risk is not zero. Infections can happen as well, and infections can mean that the implant needs to be taken out, a temporary one put in, and then another revision surgery performed so that another implant is in there once the infection is cured. So the risk of getting an infection during the time of implantation while actually in theatre is actually very low. There's a lot of amazing things which are done these days to try to decrease the risk of infection. We use the strongest antiseptic that there is. We have to be signed off to be able to use it. We have antibiotics coursing through the body while we do the surgery. We're all wearing spacesuits, so all of us, we're all covered up. Even our wrists are taped together, so there's no interface between our gloves. Even when we have the implants, the packaging, the deep sterile packaging that the implants come in, we only ever touch the implants using that packaging, so we never even touch the implant. There's pain associated with all surgery, and it's more about how do we actually keep you comfortable or control the pain. So we use the gold standard way of delivering an anaesthetic to make sure that pain is controlled from the very beginning and giving you the best chance of making sure that you won't have pain after surgery. It's a mix of a spinal anaesthetic or a nerve block, which means local anaesthetic to numb the legs, and then a general anaesthetic on top of that. The general anaesthetic is then less in the amount that's needed to be given, which means there's less risks of vomiting, nausea and things associated with a general anaesthetic, and it achieves the same goal of keeping you comfortable and letting the surgery be performed. After surgery, as soon as you start feeling pain, when the local anaesthetic starts wearing off, we encourage you to have medications from the nurses so that as those oral tablets are starting to have an effect, they get to the level of where they're effective when the spinal anaesthetic is wearing off. Generally it takes about 90 minutes to 2 hours. It depends if you want me to go for a record or not. And no one has ever said yes to that. We don't aim to be cruel, but it can be the first day you're up and moving. So once the spinal anaesthetic is worn off and you can actually move your legs, the physiotherapists come around and get you out of bed and start you walking straight away. You start off on a frame, and a bigger frame, and then a smaller frame, and then hopefully crutches or a walking stick. And that's to help normalise your gait so that you're not putting any abnormal forces on your knees or your hips or your back, so that you're able to mobilise safely. In terms of getting back to activities, people are doing office duties anytime from about 6 weeks. Getting back to doing things like more heavier tasks, it can be between 3 and 6 months. But then my farmers don't often listen to me. Those are the questions I've heard most from my patients, that I've helped move past pain and restore their quality of life. If you'd like to discuss your specific situation or have any more questions, feel free to reach out. My team and I are here to help guide you through every stage of this journey.